Hello, you welcome back to another videos. In this video, we're going to discuss on how you can treat pelvic inflammatory disease. I've discussed a lot about pelvic inflammatory disease in my previous video, but I keep getting questions on how can we treat this infection. First of all, let's know what pelvic inflammatory disease is all about. Pelvic inflammatory disease is an inflammation of the pelvis in your womb. So this is caused as a result of sexually transmitted infections that have stayed long in your body system. There are two major causes of these infections that are called this PID. Number one, we have chlamydia and gonorrhea, which are all bacteria. Now, bacteria are treated with antibiotics. So if you have PID, you have been diagnosed to have pelvic inflammatory disease, definitely you're going to use antibiotics to get rid of it. Now, how does these antibiotics work? Because of the resistance, many of these bacteria have developed resistance to a lot of antibiotics. Sometimes you're going to use what we call broad spectrum antibiotics. Broad spectrum antibiotics are those antibiotics that work for both gram-negative and gram-positive bacteria. So these antibiotics can be used to treat PID. But before then, if you are close to a laboratory, I will expect you to go for microscopic cultures and sensitivities. These microscopic cultures and sensitivity can be able to isolate either if the PID is caused by gonorrhea or chlamydia. When you go for this and the result confirm the cause of the PID, if it's gonorrhea or this thing, and what the good about this microscopic cultures and sensitivity is that it will bring out these antibiotics that will be suitable to treat these infections. That's what's called sensitivity. It's going to bring out these antibiotics that will be good for you to treat this infection. So if the result is going to the test is going to take 3 days before, that's 48 hours. And when the result is out, you're going to select among the best antibiotics there. But if you're not close to the laboratory, here are what you should do. Like I said earlier, use broad spectrum antibiotics. Broad spectrum antibiotics like rocephin, ceftriaxone, cefuroximes, and other antibiotics. There are a lot of them. You can use it to get rid of this pelvic inflammatory disease. The treatment is going to last for 14 days, that is 2 weeks. The first 5 or 6 days, you're going to use injections. Then you can complete the treatment using drugs, antibiotics to complete the treatment of the rest day. That is, either could be the rest 7 days or 8 days. Depends on the day you take the injection. So when you're on this treatment, please, you have to do this to have the best of the treatment. Sometimes you might be having pains. You can use ibuprofen, that is pain relief, to suppress the pain. If you're having itching, you can use Puritin to suppress the itching, but this does not have any effect in getting rid of it. It's only the antibiotic that can get rid of the infection that causes the PID. Now, have to practice good hygiene and take a lot of water. That is, drink a lot of water and have a lot of rest. Do by adhering to this, you will get rid of this pelvic inflammatory disease. So thank you for watching. See you in my next video, and bye for now.